Hello everybody, this is Dr. Ann Hebda at Complete Health Dentistry in Ashburn, Virginia. As the sign behind me says, welcome back. We are welcoming back patients and we are so excited to see everybody. We have some new office procedures that are in place, so I've compiled a short video showing what it's going to be like when you've come to the office, and we've added a few safety features, so we'll be reviewing those as well. And again, we are ready for you and we can't wait to see you. So I want to review the procedures that we have in place to enhance your safety and your family's safety. The first thing we will be doing is screening of questions over the phone when you schedule your appointment. Whenever you come to your appointment at your appointed time, call when you're in the parking area. That will notify us to open the door for you. It's not that you're going to be waiting in the parking lot. We just need to know when you're here so we can open the door for you so you're not touching any door handles. When you come into the office, we are asking that you come in with a mask. If you don't have one, that's fine. We'll provide one for you. When you come in, we are going to ask you to use hand sanitizer. Then we're going to go through that screening question, the series of screening questions again. We will then be taking your temperature with a no-touch thermometer. If your temperature is above 100.4, we will take it several times to make sure that's an accurate reading, but if it is 100.4 or higher, we will ask to reschedule your visit. The reason is we are a well office and we want to keep you safe and healthy and every other patient that comes into the office. So that's something I'd like you to be aware of. Once you're finished with the screening process, you'll be escorted to the treatment room. You will have your excellent treatment as always, and your next scheduled appointment will be scheduled in the treatment room, and then we will be escorting you out, again opening the door for you, so it's a very smooth, quick procedure. We are still having our personal touch. We'll be able to talk with you, and that's why we want you to have the mask during the interview process. So we are excited to see you, and we will see you soon, hopefully. Okay, so I want to review the PPE that we'll be wearing when you come in the office. I brought a model for us because you wouldn't recognize who I am in all of this. This is actually my beautiful daughter who's home from college. So I just want to review, starting at the top, we all have surgical scrub caps that we're wearing, and on top of that we have disposable bouffant covers. So those are thrown away, and this is all to keep our hair out of the way. We also have protective eyewear. We do have N95 masks. This is not an N95, even for the purpose of this video. We don't want to waste an N95 because they're so hard to come by. And then we also have face shield, which is labeled, and we have disposable gowns. And then we also have of course, gloves. Our gloves are nitrile gloves. They're latex free. We also have shoe coverings available. Most of the team members keep our shoes here, but as a patient, if you wanted shoe covers, we have them for you. And again, all of these things are for your safety, for the team's safety. This is a lot to wear throughout the day, so you're going to notice the office temperature is very cold. We need to do that so that we can function properly. So please be advised. Well, you're welcome to bring, of course, a coat, a sweater, a blanket from home. If you've forgotten any of those things, we do have blankets here, of course. We want you to be comfortable when you're here. So again, this is what we all look like in our PPE, and we are ready, and we just can't wait to see all of you. Thank you. Hello, so I wanted to review some things that we've added to our treatment rooms to make our treatment rooms even safer. Dentistry's always been great with dealing and preparing for universal precautions, and that is mainly for bloodborne pathogens. As you are aware, COVID-19 is an airborne pathogen, so we've really stepped up what we do in the practice to prevent any spread of the disease. So we know in dentistry that aerosols are produced. So we've always had high evacuation suction because of that. So in addition to the high evacuation suction that we already have, I've added another piece of equipment. And what's unique about this goes directly into your mouth, and it's squishy. Your teeth rest on this. This retracts the cheek and the tongue. It's very comfortable to have in your mouth, and this reduces 90% of the aerosol. So it's a very important addition to our practice. Very proud to have that. In addition to the secondary evacuation suction that we also have in every treatment room an individual air filtration device. What's unique about this particular device, it has a pico filter, so it doesn't just collect the virus, it does destroy it. So you're not just having a canister full of the virus, it's destroyed, so we're very excited to have that. And in addition to what we have in the operatories throughout the office, as always, this isn't anything new, we have natural doTERRA oils also cleansing the air. So, but in the operatories where the aerosols are generated, we have the very powerful filtration system which filtrates several times an hour. So the air is super clean. So please, the health of your mouth affects your overall health. We don't want you to neglect your health. We're here. We just want to let you know we're doing everything to keep you safe and healthy, and we're excited to see you. So don't put off scheduling your next visit. Thank you.